Okay, so today we're going to discuss mirror box therapy and walk through some progressions that we can do with this. So you want to start by, if you have any jewelry on, you want to take that off because you want your hands to look and feel the same. If you have any tattoos, you can try covering those up with gloves or perhaps a long sleeve shirt. Just anything that might make them feel different, because the goal here is to trick the brain into thinking that what you see in the mirror is your actual hand. So you're going to start by putting your involved hand, or the hand that has increased sensitivity or perhaps pain, inside the box. And you're going to keep the uninvolved hand outside the box. You want to angle yourself at a position so you can see that hand and it really looks like it's your actual hand. So the first thing you want to do is you just want to start with keeping both hands still and at rest. So just let them rest there and just look at them. And again, you want to think that this is your actual hand. And then after that, you can progress by just adding a little bit of movement to the hand outside of the box while keeping the hand inside the box still as well. So you can start with just some rotation of the hand. You can just flex it up and down, just a little bit of motion. And again, you want to be looking at the mirror and visualizing and seeing that hand move. After that, you can progress to touching each finger to the thumb like this. And you want to look at the mirror and just go back and forth, visualizing this as you do it. After this, you want to, with the hand inside the box, you're going to keep it still, but you're going to add just a slight bend in the fingers. And then with the hand outside the box, you're going to squeeze into a fist, just nice and slowly, and then relax. Again, you want to be visualizing this in the mirror, just slowly squeezing and relax. And as you do this, it should feel like the hand inside the box is actually performing the motion, even though it's not. The next one you can do is you'll bend the wrist, or for the hand inside the box, you can bend the wrist up and down just a little bit, just within that limit of pain. And then with the hand outside the box, you'll bend through the full range of movement, just back and forth. Just slowly getting used to that movement with the hand inside the box. The next one you can do is with the hand inside the box, you're going to oppose the fingers. So what that means is just touching the thumb to the fingertips like we did earlier. You're going to do that with the hand inside the box, just nice and gently. And with the hand outside the box, you're going to do it as well, with just a little bit more force. After that, with the hand inside the box, you're going to make a fist, and just into a little bit of discomfort, not too much force. And with the hand outside the box, you're going to also make a fist, but with more force. So just kind of increasing the intensity there. And then after this one, with the hand inside the box, you're going to rotate the hand fully. So just full rotation with the hand inside the box, and you're just going to copy it with the hand outside the box. So at this point, you progress to really performing the same motion both inside and outside the box. After this point, you can add some like a ball, and you can squeeze a ball or other tasks such as drawing or writing, and you'll be copying the motion both inside the box and outside the box. So turning it into a more functional task. And with all of these progressions, you want to progress if you're experiencing pain, and when you do the motion and then you stop and that pain goes away, that's okay. You can kind of push into that a little bit, but just stop once you have the pain and let that settle. If you stop and the pain persists, then you're doing a little bit too much. So try going back down to the previous progression, and just continue to run through those progressions until you can make it to the end when you're doing the functional tasks.